Welcome to Nursing School Explained, and this video in the new series of Care Plan Help, particularly how lab values and your patient need to be correlated. So care plans are this very nice opportunity for you to show that you understand and critically think and link the theoretical knowledge and the patient that's in front of you in clinical and see how that all relates. So this particular video will focus on lab values, specifically white blood cell count and nursing considerations. So here, white blood cells, when we have white blood cells on the result for our patient, we should always think about potential infection or inflammation. So don't jump to the conclusion that the patient has an infection. There might be some other things going on, but there are certain things that we can do for our patient to assess their vital signs and their white blood cell status and keep an eye on maybe trending up of those white blood cells. So vital signs that relate to inflammation and infection are always temperature, right? Your temperature is going to go up, and then it might also reflect in the heart rate and the blood pressure, meaning the patient would be tachycardic and potentially hypotensive. We'll go into the purple here in a little bit. Then complications that arise from hospitalization always include, think about the lungs and the urine, because patients might develop some sort of atelectasis or even a pneumonia and or urinary tract infections. So we always want to assess the lung sounds and their urine, and that doesn't necessarily mean a urine sample. We can just gather subjective data, how's your urination, any burning, any change in color, and so forth. And then we want to check any kind of surgical sites or wounds, and that includes drains and maybe burn injuries, any kind of skin breakdown that could be the cause for this underlying inflammation and infection. We always want to check other pertinent sites, so look at the admission data and see what else the patient might be at risk for given their past medical history. And then think about any potential complications of the diagnosis and the main problem that the patient is there for. So anybody who's bedbound is at risk, like I said, for lung complications and urine complications. But if there are underlying condition that has to do with their kidneys or their liver or anything else, any immunocompromise, we want to specifically tie that into the patient's analysis. And so then over here, I came up with an example, very simple example of a patient, a 45-year-old female who is status post-cholecystectomy. So she had her gallbladder removed, past medical history includes diabetes, hyperlipidemia, and she's a smoker. So now when we think about those white cells, we can assess the vital signs like we already talked about, and then interventions over here are in purple. So we can give her antipyretics to get that fever down. We can also give her IV fluids to keep her hydrated, get the heart rate down and the blood pressure up. We can encourage the use of an incentive spirometer and or maybe check a urinalysis if that's indicated. For any surgical sites, after we assess them, we want to check for dressing changes and any wound care that we might need to be providing. And then if we think about any potential complications, so in this patient who is also a diabetic, post-surgery, we know that hospitalizations cause stress response, and so does surgery. So we want to keep a close eye on the patient's blood sugar, see how much she's eating, note the percentage of the meals, and then give her insulin to keep that blood sugar down to make sure that she can heal properly. So these are all tied into the patient's white count. First we assess, and then we intervene, and if you can show this relationship on your care plan, your instructor will be very happy with you and you'll get a good grade, plus it'll foster your critical thinking. Thanks for watching. Check the other videos that pertain to lab values and nursing considerations on your care plans coming up in the next few weeks. Thanks for watching.